The sun is still an hour away from rising, but it's an early appointment, and Terry doesn't want to be late, especially for Madeline.
She's a sweet little old lady. There's hardly, well, you'll see that there's hardly anything to her. She likes to go with somebody else, especially for taking trips to London or something. Oh, morning, Marilyn. Is Terry from the Salvation Army here to pick you up?
Terry is a volunteer with the Salvation Army in Woodstock, Ontario.
Morning. Bright-eyed and bushy-tailed?
He's been taking Madeline Baristo to hospital appointments for the last year.
Get them to take me there and then bring me back, and then if I have to go to one of the other hospitals around here. And he's a good driver.
Been down there fishing a few times.
It may seem small, this act of kindness, but it's a lifeline. Baristo is on a fixed income and can't afford the cab fare to and from the closest hospital that is an hour away. She has no one else to take her or wait with her.
With the other ones, I just drop them off, make sure they're in the building, then I just disappear for a couple hours.
Why do you wait here with Madeline?
Well, I don't know, just something seemed to tell me to just stick with her. I'll be waiting.
A touching gesture, a deeply human one, and all part of a small but critical community program, one that is based on the reality that thousands of vulnerable people in this area alone may be entitled to health care, but just can't access it.
But is it up and running still?
Vanessa Giuliani runs the Salvation Army's Family Services Program. It was the seemingly small yet insurmountable obstacles that got to her.
I've had issues of people taking their heart medicine that they need every day, every other day, to spread it out because they can't pay for it. I mean, wow, that's wrong. Come and grab a seat, my love.
So Giuliani created the wellness program to fill in the gaps, gaps that seem small, but not to people like Melissa Atkinson.
So this is sleep dentistry.
Yes.
And what are they actually doing for you?
I have to be put to sleep to have some teeth pulled. Normally you can do it awake, but I had oral surgery about 2 years ago, and they have permanent nerve damage.
That's right.
Atkinson is a single mom on disability. She needs a lot of work on her teeth. The dental part is covered, but not the sedation required. It costs $250, and she can't afford it.
So you cover the whole $250?
We cover the whole $250.
That's amazing.
All right. Thank you so much, my love. You enjoy the rest of your day and let me know.
It helps people who can't afford to do things.
What would you do if you didn't have this?
Probably suffer with pain and not have my teeth fixed.
Dental work is just one example. Blood pressure cuffs, diabetic strips to test blood sugar levels, a ride to an appointment. The needs are basic.
It's those little things that seem so small and insignificant that can trip you up. It's not the huge thing that we think it is, that they can't pay the rent because they have overspent on a night out. Absolutely not. That's not what it is. It's getting the medicine for the child or for themselves or looking after an aged parent.
The program runs on donations and on a budget of about $30,000 a year. People who use the food bank or shop in the thrift store make up most of the clients.
Okay, come on in and let's see what we can do for you.
The working poor, people with disabilities, seniors squeaking by on small pensions.
Did you have an application?
Lynn Johansson had a long career as a nurse, but she's retired now. And before this, had to choose between groceries and paying a medical bill.
When you have no benefits, it's a lot of money when you're on a pension.
Now where are we going?
There's small bridges to health care, and there seems no end to the need. Baristo's health is now a constant concern.
And this is as far as I go.
Doctors have found a worrisome blockage, are afraid it could lead to a stroke.
Okay.
So we'll probably want to see you here a few more times.
Okay.
She knows she can count on Terry to bring her back.
If I have to come back to the hospital for the test, I don't know who else to phone. Otherwise, it's going to cost me a hand and leg to get here because there's no other way.
It's one less worry, one huge relief. Simply from a companionable ride and the unspoken comfort it brings along with it. Joanna Brumiliotis, CBC News, Woodstock, Ontario.